I'm delighted this morning to come over and spend a little bit of time with Raphael here on the Healthwatch bed, because I really totally believe that Healthwatch is putting a spotlight on health care within our local community, and how we all work together and connect together is really, really important, because some patients have a really good experience and some people unfortunately don't.
We rolling?
We're
okay.
rolling.
Let's roll together. Come along. I've had good doctors and very good surgery. Oh, everybody was nice, and I think if you treat people nice, they treat you nice. But I think that they should get away with the people up the top and not give them such high money, and definitely no bonuses.
I have a lot of friends that work in health and social care, and I really feel for them a lot of the time, because the good intentions are marred by the paperwork and the money and all the stuff that's not what it's about, really.
Well, I can't complain, to be honest, with the NHS, because, as I say, both my husband and me had cancer at the same time. He had prostate cancer and I had bowel cancer, and they've been amazing. I can't praise them enough.
My mum died last year, and my dad, who's elderly, in his 80s, carefully loaded up 2 walking frames, 2 sets of walking sticks that she had at home, into the car, drove from Ongar to Epping to return them to the physiotherapy department there, and they were brusque, rude and abrupt with him, telling him he couldn't leave them there and he'd have to take them to the tip because they couldn't use them. And I think that's such poor service, following what was fantastic service when my mum had a stroke. East of England Ambulance Service, again, marvellous care, taken to Queen's Hospital in Romford, and right from when she arrived to when she died, every single member of staff that spoke to us was outstanding in their kindness, compassion, caring, and my mum had a dignified death.
My grandpa is elderly, and he's recently gone into a care home, and it's just trying to find the resources that are out there, and kind of being lost in a field of different providers. Sometimes we've had experiences of where we felt like they are talking about a name on a bit of paper, and essentially Grandpa is a name on a bit of paper, but he's a family member to us.
I noticed that he came up in a rash on the palm of his hands and his feet, and a bit around his chin. So I called the doctor up immediately, and to my surprise, he got an appointment within 10 minutes. I was absolutely pleased with that experience, because I know that doesn't happen in a lot of other places.
My dad's got dementia, and by providing the support on Canvey, we're making it the whole island and the whole area of Castle Point and Rochford dementia friendly. So I'll be able to take him to even more places to visit on our days together, and we've got even more things to do.
One of my main concerns is the wastage of medication. A couple of years ago, I spoke with a pharmacist about wastage, and I was told that on that particular day he'd had 2 separate patients' medication returned, and it hit around the £15,000 mark. And because it'd been out of the pharmacist, they just had to dispose of it.
I actually came into hospital for what can only be described as the worst experience of my life, finding out that my baby's heart had stopped. But the care that I've received here from the midwives who delivered Isla and Tabitha, the bereavement midwife, the support she gives us mums and dads, it's just amazing and way beyond words. It's priceless. I lost Isla in the beginning of July, and Tabitha's still always on the end of a phone. You can't put a value on people like Tabitha. She's just an amazing, amazing lady. I'd be lost without her.
My partner suffers with bipolar a lot. From my experience with my partner, for years she was going to the local centre and she's getting a different psychiatrist every time. So there was no continuity, no relationship built up. However, they say it's changed now, that they've managed to get her a regular psychiatrist who says he's going to stay here. But she can only see him every 6 months.
I believe in education and sharing stories and sharing one another's experiences.
because we can all learn from each other, because it is about understanding each other's challenges and problems and trying to identify areas that we can all improve and deliver the best service we can for patients.